Good morning, everybody, and welcome to the Balancing Act. We're so glad you're here. I'm Julie Moran.
And I'm Olga Villaverdi. You know, food allergies are serious business for millions and millions of Americans. But now there's a way to make shopping so much easier for those who need to know exactly what ingredients are in their favorite foods. This is such great information, and we're going to explain.
Yes, it is. Whether 16 or 36, acne can be a problem for women at different stages of our lives. And luckily, my girls are doing fine. But for so many, it can be severe. And we've got some great solutions.
And a look at osteoporosis. Packed show here. The Balancing Act starts right now. Osteoarthritis is a disease leading to breakdown in the cartilage between joints, including the knee. Very often, it's painful and can lead to swelling, stiffness, and overall joint and cartilage damage. With us today to discuss the condition many boomers, even younger men and women, are facing as well, is Dr. Jess Launer, an orthopedic surgeon from Philadelphia's Rothman Institute. Good morning, doctor.
Good morning.
Thank you so much for being here this morning.
Thank you.
Let's talk about osteoarthritis briefly. What is that?
Arthritis is basically a breakdown of the cartilage surfaces of the knee, and it affects millions of patients.
So what causes it, and is it more prevalent in men or women?
There are a lot of things that cause it. First, there's a strong hereditary component. It's written in our genes. But there are other things that can contribute it as well. So for instance, if someone's obese, they put more stress and strain on the knee, that can cause arthritis. Remote injuries to the cartilage or to the ligaments of the knee can also cause arthritis.
And do you see it more in men and women in your practice?
Well, about 2/3 of our patients are actually women.
Really?
Yeah.
I would have guessed men.
Which is the very common reaction, but it's very counterintuitive.
And what have been the, let's say, traditional non-surgical options for patients who have this?
There are a variety of things that can be considered. A weight reduction program.
And they did that to my dad.
That makes a lot of sense. Organized physical therapy.
He did that too.
Activity modification, medicines like nonsteroidal anti-inflammatory medicines. Tylenol can be helpful. Injections, and sometimes even bracing can be considered.
And we did all that for my dad, so we had to then go to now a surgical option, and he actually did last year a total knee replacement. Common?
Total knee replacements are very, very common. More than 600,000 are done in the United States every year.
Wow.
But about 30% of our total knee replacement patients are actually candidates for partial knee replacement because the arthritis is much more localized to one part of the knee.
So what's the difference? I mean, I can imagine what it is, but can you tell me the difference between a total and a partial? And I guess the recovery, I'm assuming, is going to be a lot easier.
Oh, it is. So let me just show you a model of, this is the model of a knee, and it actually happens to have a partial knee replacement in it. If we were doing a total knee replacement, we would remove all of the cartilage surfaces of the knee. But with a partial knee replacement, we can expose the joint through a smaller incision and then remove only the one compartment of the knee that's affected by the arthritis. Oh. So we do this on an outpatient basis typically.
Easier to do.
Much easier to do. Although there's some caveats to that.
Okay.
The recovery is quicker. Patients typically are off their pain medicines more quickly. They can return to work more quickly and get back in action far more quickly than they can with a total knee replacement.
Now, I know there have been advancements with partial knee replacements. Can we talk about that today?
Sure. As attractive as partial knee replacements are to physicians and to patients, the reality is that unless they're done with great precision, the durability of a partial knee replacement may not mimic the durability of a total knee replacement. And we certainly want these to last a very long time. So one of the biggest advances that has come out in the last 5 years in partial knee replacements is robotic technology.
And what is that? Because I know we have a video for our viewers, and explain to us what's happening here.
Well, basically what robotic technology is it's a very smart way of preparing the bone. We can determine in advance of surgery how much bone we want to remove, how we want to orient the parts, and it also allows us to very precisely balance the ligaments of the joint. And those three elements are contributing dramatically to the long-term success and durability of these partial knee replacements.
So really making a difference for the patient, not only the next week, the next month, but long term.
Big time.
Have you seen a patient that comes to mind that something like this and this advancement really was a turning point?
Well, I've been doing surgery for nearly 20 years and using robotics for about 7 or 8 years. So I do have a lot of stories, but one of the stories that comes to mind is that of a 67-year-old woman who was literally just in my office the other day, who within 3 weeks of surgery began hiking a recent mountain range near her home in New Hampshire.
And she couldn't do it before.
Before that, she was hobbled with a cane, couldn't enjoy playing with her grandkids, was really struggling.
That's wonderful. Thank you so much for everything you do. Appreciate your time. Great information. And if you'd like more information on today's topic, go to our website. It's really easy, thebalancingact.com, or log on to Facebook.com/The Balancing Act fans. Acne. It's a problem all women, no matter their age, can relate to. Now, while it may start in our hormonal teenage years, the issue can reappear over and over. I know this. So with us discussing effective ways to manage and control acne, including the more severe forms, is Dr. Sherry Ingraham, a board-certified dermatologist from Advanced Dermatology with multiple offices and locations throughout the greater Houston area. Good morning, doctor.
Hi, thank you for having me.
Thank you so much for being here, because I know this is a topic that a lot of women and teenagers can relate to. So let's just talk real quick, the definition of acne, what it is, what causes it.
Right, so acne is a chronic disorder of the pilosebaceous unit, which is essentially a hair follicle and its associated sebaceous gland. And it can manifest as pimples and papules, or comedones, which are what we think of as whiteheads and blackheads on the face, and even cysts and nodules. And it tends to occur in what we call sebaceous areas. So these are the face, the shoulders, the chest, and the back.
And it affects in terms of many different ages, right? It's not just, you think teenagers because of the hormonal changes, puberty, but we're talking from maybe 8 to, who knows, right?
Right. We know that greater than 90% of adolescents get acne, but what we're realizing now is that adult men and women get acne, especially adult females, and we're getting more and more studies showing that adult women are particularly burdened by this disease, and it causes a lot of emotional distress, as you can imagine.
It does, and I've seen it in young girls where it bothers them, and that's where this question comes in. At what point do you think someone with acne should then say, okay, let's get professional help, as opposed to just putting creams and trying this and that?
It's a very good question. You know, we see patients brought into the dermatologist, and we recommend they seek dermatologic care when their acne is inflammatory, when it is severe, because this can lead to scarring. And my job as a dermatologist is absolutely to prevent scarring, and early intervention is key. Also, if they've tried over-the-counter preparations and they aren't getting results, and most importantly, if a parent notices that a child is becoming withdrawn or depressed because of the appearance of their skin, they should seek the care of a dermatologist.
And you hit a good point, because you can go to any drugstore, and there's just a plethora of treatments out there. And I've seen a couple of teenagers that I know, my nephew, for example, who has tried so many things. So what have you found, because you have seen this, you are a pro here, that is an effective way to treat acne so that someone can feel like they're getting the right thing?
So if they have mild acne, what we think of as whiteheads and blackheads, which are comedones.
Which is common.
Right. Really, first-line therapy is a topical retinoid and perhaps a topical benzoyl peroxide with a combination topical antibiotic. However, if they're developing severe inflammatory lesions, then we need to think about adding an oral antibiotic such as doxycycline or minocycline. And we give these antibiotics not only to treat the underlying bacteria, but also because of their anti-inflammatory effect. Now, there is a newer product on the market today, which is Acticlate, which is a doxycycline hyclate tablet that I like to use. And the reason I like to use this is because it's a small, easy to swallow tablet. Patients are usually told to absolutely take this with food to avoid an upset stomach. And I also tell patients that it does take several months to see improvement, but what you're going to see is a reduction in those inflammatory lesions, and again, a reduction in the risk of scarring, and this is so important. And that's why we prescribe this class of antibiotics.
And when you've used Acticlate with your patients, you've you've seen a significant change in the treatment?
Yes, an oral antibiotic like Acticlate is an essential imperative adjunctive therapy for the treatment of severe acne. Of course, I tell my patients when I'm giving them this antibiotic, it is a tetracycline class of antibiotic. So they do need to be aware of certain things. I can't give it to pregnant women. Children under the age of 8 years of age cannot take this medication. And also it does have certain side effects we need to be aware of. There is a risk of photosensitivity and a severe sunburn reaction. So of course, as any dermatologist, I tell them they need to wear their sunscreen, and also they need to take it with a large amount of fluid to avoid esophageal irritation or ulceration.
But in what you've seen in terms of patients taking it, the benefits outweigh maybe the risk?
Oh, absolutely. You know, it's very rare that there's a problem. As long as you educate patients to take this medication, I find compliance is key, and if you're giving them the information, they're able to get this medication and tolerate it because of the limited side effects. They do so well, and it really helps them in the long term combat this ongoing disease.
And let's talk about in terms of, just finances, because sometimes these can be a bit expensive and families just can't afford it. How does this compare?
As a dermatologist, I feel so fortunate because the manufacturers of many of the acne medications which we prescribe now offer coupons to help offset the copays associated with these prescriptions. So with this medication that we're talking about, Acticlate, for example, they have a program for eligible patients that makes the medication no more than $10 with each script.
Thank you so much for what you do.
Thank you
for
having
information
me.
where viewers can go and learn more, where would they go, doctor?
Acticlate.com.
Acticlate.com. And if you'd like additional information on helping manage severe acne, you can also visit the website, our website, thebalancingact.com, or get social, log on to Facebook.com/The Balancing Act Fans. You're giving me a migraine. Now, most of us have heard that before, but for many migraine sufferers, they're not talking about a person causing the headache. They're actually talking about causes found in so-called migraine triggers. Big difference. Joining us to discuss this and food allergies in general is nutritionist Victoria Brodsky of Content Checked Incorporated. It's a company offering peace of mind by putting knowledge of harmful food ingredients literally in the palm of your hand. Welcome back.
Thank you.
Thanks for being here.
Of course.
I'm really glad we're talking about this morning because I know quite a few people that suffer from migraines. And it's a big difference from a headache. Some people can't even get out of bed for that matter. So let's talk about migraines, maybe what causes them and why people are just so paralyzed.
So what exactly causes a migraine? There's still a lot unknown.
Sure.
We do know that, the blood vessels constrict and the pain is there. We also know that there are certain things like hormones and stress and certain foods that could actually trigger those physiological responses that will, cause that migraine.
And let's talk about some of those foods that can be triggers.
Some of the big ones are chocolate, red wine, but there's also any kind of fermented food, any kind of food that's excess in salt. There's also dried fruits and things like that, things with sulfites in them. So there's a lot of ingredients that people may not even realize can be a migraine trigger.
I know, and I know about the wine and chocolate, but a lot of people, like you said, don't know. And what I love is you've created an app that will help people and kind of guide them. Let's talk about that app and what you've done with it.
Absolutely. So this app is wonderful. Basically what we've done is we have taken all these products that we either get information from the manufacturer or consumers can actually add the product to the app by scanning it with the barcode. So basically what it is it's a scanner. You scan the barcode for a food product and it'll tell you whether or not one of those ingredients is a migraine trigger or it has traces of a migraine trigger.
Show me how it works. So let's say I'm in the supermarket, I'm a migraine sufferer and I want to buy what? Chocolate? Oh,
yes.
Let's do this chocolate right here.
Yes. So here you go. You just open up the app. It's a scanner. So basically all you have to do is just hold the camera on your phone up to the barcode. And then here, it'll tell you right away. It has all the information. It's got a picture of it. It's right there.
And look what it says. Sorry, this product triggers migraine.
Yes.
So that is one that I or anybody that suffers must stay away from.
Exactly.
Tell me what else it shows.
So it also shows in big visible letters the ingredient list so that you can say, okay, well, what in here maybe cause a migraine? So chocolate is definitely a migraine trigger in and of itself. So what's cool about the app is that it shows alternatives So similar products that don't contain a migraine trigger. However, because chocolate is one of the biggest migraine triggers, it's going to be hard to find an alternative.
I could only imagine also as a nutritionist, I would think that if you're able to do this, you can also find more value in maybe what foods you're getting as well.
Absolutely, absolutely. So the huge list of migraine triggers that we have, there's a lot of ingredients that, I mean, any nutritionist would want you to avoid. Excess salt, excess sugar, things that chemical names that are preservatives or sugar alternatives and things like that. So definitely it's a great start to if someone wants to avoid some of these foods, because a lot of the foods that are marked as a migraine trigger are actually processed junk food. Of course you want to avoid that.
What about, Victoria, some new products that hit the market and you're right there and you want to try it that day? Are you up to date?
Definitely. We are definitely as up to date as we possibly can. If we do have the manufacturer information on the shelf, the information will be right there in the palm of your hands. If we don't, the user can actually add the product manually. By scanning the product, it'll say, I'm sorry, this product does not exist, and they can press a green button, big green button that says add the product. It'll go straight to our database for analyzation.
And you'll do the work for them.
Exactly.
I can only imagine that this could be changing lives and people's lives. I mean, have you heard that from someone that you know?
Absolutely. I definitely have a couple family members as well as myself who we had no idea that certain foods and certain ingredients would actually trigger a migraine. So it's very educational, and it's also very helpful because it saves time in the grocery store and it saves you a big headache.
And you know what? It could save you from popping that pill also.
Absolutely.
And avoid taking the medication because you weren't aware of what was causing it.
Absolutely.
All right, for our viewers who would like more information on this fabulous app, where do they go?
ContentCheck.com. And we are also on all social media sites, Facebook, Twitter, and Instagram.
And that's Content Checked with an ED.
ED, correct, past tense.
All right,
yes.
thank you so much.
Absolutely, thank you.
I really appreciate all the information.
Great.
This has been, by the way, the third in our series on food allergies. More great information coming up in a future show, as well as in the meantime, check out our website, thebalancingact.com, for programming updates on this topic and others. And of course, we love to be social, so get social with us. Log on to Facebook.com/The Balancing Act fans. So much great information on today's show, valuable stuff. Now, if you want more information on all our segments, just go to our website. It's thebalancingact.com.
All right, don't forget about Facebook and Twitter. Look us up. We'll see you again soon. And remember, find your balance, everybody. So long.